Hello, everyone. Thank you for joining us. Today, we will be addressing how genetic testing is impacting healthcare and wellness. We started a collaboration not too long ago with East Alabama Medical Center, and we'll be diving into that. We'll also touch on a little bit about how we're adapting in times of COVID, because that is our new world. But before we get started, I wanted to thank both Russ and Mark and the entire Health Connect South team for all the work that they've done to pull this virtual conference together as we adapt in this strange new world. It's an honor to be back on the stage this year. Today with us on our panel, we have Dr. Devin Absher. He's a faculty investigator at Hudson Alpha, as well as the Director of Genomic Health. We have Nancy McDonald on the screen. She is the Director of Employee Benefits and Wellness at East Alabama Medical Center. And I am Jessica Merritt, the Director of Business Development at Hudson Alpha. So at last year's event, we announced the collaboration between ourselves and East Alabama Medical Center, where we would bring genetic testing as a wellness benefit to a pilot population of East Alabama Medical Center employees. So that's what we'll be diving into a little bit more. As many of you know, genetic testing is becoming more commonplace. It's a lot more accessible now. And what many of you may not know is that it is becoming much more commonplace to offer as a wellness benefit. So there was a survey done in 2018 by the Society of Human Resources Management, where they surveyed their members and found that 18% of employers are now offering genetic testing of some sort as a wellness benefit. So we'll dive in a little bit more to our collaboration and our program where we've done just that. So before we get started, I want Devin and Nancy to introduce themselves as well as their organizations. So Devin, you go first.
Okay, so as Jess said, I'm Devin Absher. I'm one of the faculty at the Hudson Alpha Institute for Biotechnology in Huntsville. Hudson Alpha has been around for 12 years. We have a four-pronged mission of research, economic development, education, and genomic health. All four of those mission areas are critical to the project we're going to be discussing today because it really incorporates some of the cutting-edge research we do here at Hudson Alpha, as well as our goal to get genetics and genomics into the hands of clinicians so that they can improve the healthcare of their patient populations. And it also incorporates a lot of the educational goals that we have as we have a number of programs where we create materials for the general public, for students, for teachers, and even clinicians to help them understand the power of genomics and how it can be applied. So the Institute has had a long track record for the last 4 or 5 years in the clinical space. We have a clinical lab on our campus, a CLIA CAP certified clinical lab that focuses on genetic testing and genomics and how it can be delivered to clinicians. And then we also have the Smith Family Clinic on campus, which is a clinic focused entirely on rare genetic disorders. It includes expertise from medical geneticists, genetic counselors, and pharmacists who have a background in genetics. So the program we'll talk about today really leverages a lot of the things here at Hudson Alpha.
Nancy, it's your turn.
Hi, I'm Nancy McDonald. I am the Director of the Clinical Benefits and Wellness at East Alabama Medical Center. I'm also a nurse practitioner by trade. East Alabama Medical Center is a 350-bed facility. We have a nationally recognized cardiovascular program. We have a state-of-the-art cancer center. We have a nationally recognized orthopedics program. We are in the process of expanding our footprint into Auburn with a freestanding ER and ambulatory surgery center. We have an alliance with Lanier, EAMC Lanier, which is up in Valley, Alabama. We are also getting ready to open an ambulatory surgery center at that facility. I have been at the facility for 30 years in some form or fashion, nurse practitioner. We decided to enter into our collaboration with Hudson Alpha after our senior leaders, Susan Johnston, who's our VP of HR, and Laura Grill, who's our CEO of the hospital, are very interested in expanding this program and providing this state-of-the-art facility and the pharmacogenomics to our employee population. We feel like we will be able to gain some valuable clinical interventions from having this information, and look forward to expanding and providing this for our employees further into the future.
Wonderful. So Devin, if you would tell us a little bit more about the genetic screening program and exactly what we're doing with East Alabama Medical Center, that would be wonderful.
Sure. So one of the complexities of genetic data and genetic testing, whether it's being used for a diagnostic test to diagnose some rare genetic disorder, or whether it's used for a screening purpose, like it is in this case in the program we're going to talk about, for example, to screen for potentially inherited genetic variants that contribute to cancer risk or to other diseases, or in the case of the East Alabama Medical Center project, a pharmacogenetic test in which genes that influence how you metabolize medications to be informative for patients. In any of those cases, it's a complex process that requires a lot of integrated services to make it effective. So what we've done at Hudson Alpha is start a program for the Hudson Alpha Health Alliance to help our partners and our collaborators stand up these programs. And it's really an integrated suite of clinical services that helps facilitate that process. So that really means from the front end, providing educational materials to patients, or in this case, employers, so that they understand what this genetic test that they're being offered can tell you, what it can't tell you, what its limitations are. And that really utilizes our background in education and utilizes a lot of the materials we've developed over the years to help explain genetics and complex concepts in genetics to patients. So there's that part of it. There's also a project coordination part of the project. And of course, there's the lab test that is necessary. But it's really more than just generating the lab results and handing it off and expecting an employer like East Alabama Medical Center to act on that appropriately, or for their wellness center to act on it without any help. We really want to provide a whole suite of support services to make that program work. So after the test is delivered, we also offer access to the expertise we have on this campus that comes from medical geneticists and genetic counselors and pharmacists who have a background in genetics to help support those test results. That way, it's not simply a handoff of a 30-page report that will place a burden on the physician on the ground who ordered that test to really do all the background work. So this Health Alliance is really an opportunity for entities, clinical entities who are providing some sort of genetic testing program to gain access to the expertise and the infrastructure that we have here at Hudson Alpha without standing it up on their own. So that's really the basis of this collaborative effort with East Alabama Medical Center. Nancy can certainly talk to the specific employee population that's being tested and their reasoning for choosing that population, but effectively we are providing a pharmacogenetic test that hopefully will inform their employees' choice of medications and help their physicians decide the best medications to utilize for their specific care, as there's a number of genetic factors that often determine what medications we metabolize or don't metabolize, and it can greatly influence our long-term health outcomes. So that's really the motivation and the sort of background infrastructure that we built as part of this collaboration.
Thank you, Devin. And as many of you know, and Nancy will speak to too, any employee wellness program is only as good as, as employees take up on it. So one of the key factors in what we're doing here and our partnership and collaboration with East Alabama Medical Center was not just, hey, we have this test, it will help your employees know how they respond to certain medicines, but it was that front-end engagement, as Devin mentioned, the education, the employee engagement, answering questions, because this is something new for employees. What does this mean? Is my employer going to have access? Speaking to the firewalls and the privacy, as well as providing the testing and the clinical decision support. So Nancy, at East Alabama Medical Center, the way that you all wanted to approach this pilot, you looked at a very specific pilot population that you wanted to start with. Can you speak to why you chose this population and what you were hoping to learn?
Yes, so through our wellness clinic, every year we would have employee wellness screening. So we would check for lipids and glucose and A1C and other biometric factors. And so we had noticed that we were seeing a trend in our population in the cardiovascular lipid realm where the numbers were steadily going up. They weren't coming down or being controlled. And so looking at the aggregate data, we realized our average LDL across our population was between 120 and 130, and our average total cholesterol was about 220, which there are other factors that go into it, but we looked at that specific trend. And then we looked at the patient's history, if they had been on medicine in the past, if they hadn't, what their BMI was. And so we took the top 100 as far as their levels and their trend increasing. And we sent a letter. We worked with Hudson Alpha to get the materials and the letter together and said, we're starting this pilot program. It's no cost to you. This pharmacogenetic program will look at your specific genetic profile and your ability to process statins. Are you on the right one? Have you had problems in the past and you're afraid to take them in the future? So we wanted to look at the here and now to think about the long term and the effects of those that population and not being controlled. So we sent the letters out. We met with, had several sessions, education sessions for employees, a lot of interest, a lot of skepticism, a lot of, who's going to have access to my information. And then we had a lot that were like, yes, I've been waiting for this. I really want to participate in this. So we had a lot across the board. I also met with our physicians. I met with our cardiology section. I met with our general internal medicine section, and did not have one physician that was not, yes, this is the way we want to go. They were all very much excited to see us doing this and to have this information. The biggest question was, are they going to be able to interpret the information, and who's going to help them do that? So through the wellness clinic, we actually have a PharmD who was at our hospital for many years in the clinical role, and has helped us through this process. So we sent out appointments to our participants. So from January to March, our whole year goal was 100, but COVID hit. So January through March, we had 41 participants in the program. So we made them an appointment. They came to the clinic, signed their consent form. We drew their blood, shipped it directly to Hudson Alpha. Once the results were ready, we had a collaboration between myself and the pharmacist and the Hudson Alpha staff to go through those results and make sure we were all comfortable with them and what they meant and how we were going to present this to the employees. So our PharmD, before COVID, would meet with the employees in person, go through their results, and then actually communicate directly with the physicians. And this worked really well. She was very versed in our specific population and knew our employees on a name-by-name basis. They weren't just a face in the crowd to her. She knew a lot of their history, so that was very helpful to us. And she knows our physicians. The physicians had some wonderful feedback. After COVID hit, we actually flipped the tables and went to virtual Teams meeting or Zoom meeting with the employees. That actually worked out really well. So Chris was able to speak to the employees, discuss their results, share the screen so they could see everything in real time. And then she was still able to communicate that to the physicians in an appropriate manner and make her recommendations for this population. We also found some information on the side that was very, very good for us to have. We had a whole level 1 drug profile done, which was very nice to look at the patient's entire medication, current medication history, and compared the results to what was happening. And we found some significant results on a lot of patients that can potentially impact their care in the future, not just from a statin perspective. But we felt like that this would be an easy population to start with and to get people on board with. And so hopefully we will be able to expand that to other medications in the future that have currently impacted patients, but weren't really the initial goal to start with.
Thank you. And you touched a little bit on, some of the findings, some of the outcomes. Obviously, we did start and we weren't expecting everything to change in March, but it did. But that's pretty good for getting in 2 months, 41 of the 100 already in, booked for appointments and samples sent. So of those 41, do you have any success stories or any outcomes that you can share about what the employees learned and any benefits that they found?
So we had several. We actually had an employee who actually ended up in the hospital in January for chest pain and had actually been one of our test patients. She had volunteered first and said, I'm gonna do this. So we got her results back. She had a heart cath. She had some soft blockage in her LAD, which is her main artery, which was very surprising to find. She's in her 40s, mid to late 40s. So she had uncontrolled cholesterol for many, many years. She actually was my patient in a private practice and had not been very amenable to getting on a statin. So once we found this out and we got her results back, it was very enlightening. So she was started on a statin. She, after about a week and a half on this particular statin, she had to stop it. She said, I cannot tolerate this. I'm swelling, I'm hurting, I can't. So when we got her results back, we did discover from a statin perspective, she is a very slow metabolizer, which made complete sense how she had the response she had. We also made the discovery that CoQ10 would be a very positive impact on her. And we discussed these results with her and her cardiologist. And when her cardiologist got that paper in front of her, she just sat there and just went through line by line by line. And sitting there with her said, okay, this is what you're on. This is the plan we're going on, and we're not changing it. We're gonna adjust it based on this and how you're gonna tolerate it. So from that point to current, She has been on the recommended regimen, no problems with the medication. Her current total cholesterol is down to 150. Her LDL is at goal in the 70s. And she is feeling great, not having any problems with it. On the side note, with the level 1 drugs, we also realized that we had the antidepressants, antipsychotics, and she was also on some of those medications. And we discovered the medication she was on was not the medication for her. And that was a significant discovery, as she had had some other health issues that had been impacted by those particular medications. So we shared that with her internal medicine physician. We also shared it with a specialist she was seeing in Birmingham. And in turn, those changes were initiated. And so the overall impact for this particular employee from multi-levels has been phenomenal, and has had such a positive overall impact on her well-being, on her health. It truly opened our eyes to how far we could take this. And several, employees that have gone to physicians and took their results or had discussed with Chris, years on a medication that probably wasn't right for them. They'll walk in the office with this, and after talking to Chris and just say, okay, we got to switch you now. Let's see if we can push this further. So really, really phenomenal.
Wonderful. So again, obviously COVID changed everything. So we are now figuring out how to adapt in these times. So I know the East Alabama Medical Center Wellness Center, where this testing was being done previously, then became a testing site, and the employees of the hospital were working hard to keep the community strong, healthy, get them back out there, and we're kind of overwhelmed. So we've been talking through how we might adapt our program. So I want both of you to speak to that, but maybe Devin start about where things were when we first launched this pilot with East Alabama Medical Center, and how we're looking to shift gears a little bit on like testing. And I know we started with blood samples.
Mm-hmm. Yeah, I think the COVID catastrophe has really opened everybody's eyes to some degree about how engaged a patient population has to be with their healthcare, whether it's understanding what tests they've had, keeping track of the tests that they've had. And then, of course, it's even doubly so now for employers who have to know which employees have had what tests. Of course, there's HIPAA laws in place and firewalls to ensure that the data is not shared with the wrong people within an organization. We can talk about that. But the point is that there needs to be some communication channel that facilitates a lab testing regime in an employer-employee setting. So it's helped, I think, everybody understand the importance of this, and having the right infrastructure in place to make that happen. But it's also made it more difficult, as I think more patients are reluctant to go to their regular physician visits. And I think everybody in the healthcare world, and I'm sure Nancy can talk about East Alabama Medical Center and the impact it's had there on their non-COVID related healthcare. But there needs to be other mechanisms, other infrastructure in place to help facilitate this sort of testing. And one of the things that we've done at our lab on campus, the Clinical Services Lab, is that it's validated a saliva collection kit for DNA. That, of course, will make it a lot easier to disseminate those kits to patient population or employee population, and to have them return results to the lab without an in-person visit with a phlebotomist to get a blood sample. So I think that will make things easier going forward. Obviously, there's still a lot of work to do to make sure that these sorts of virtual communication between all the parties is maintained, and that's another thing that we're building infrastructure for. We'll talk about that. But it's obviously a lot of this communication between the PharmD, the clinicians, the patients, the employer, HR wellness, all have to be coordinated. And that's, I think, something that we're really focused on.
Totally agree. Yes, I think that we've all had to get used to a lot more quickly than we would have expected this virtual world. We've all shifted gears. I mean, last year we never would have considered we would be doing this conference virtually, but here we are doing everything virtually. So as Devin mentioned, yes, when we started this pilot with East Alabama Medical Center in January, because they are a health system, they were very adept and used to using, doing blood sticks, doing blood samples. So that's when we set up our protocol for testing of the employees. That's how we set it up. And as Devin mentioned, throughout this time, now our lab has validated the saliva kit. How do we shift gears and make things easier for people to participate? And we've had a lot of virtual sessions with Nancy and her team, Chris over at the Wellness Center throughout this process. But Nancy, I know you mentioned that you all were shifting gears as well on how you were dealing with those. So do you want to talk about that a little bit?
Yeah. So, so before COVID hit, our wellness clinic was able to bring those employees in. And because, our wellness clinic is offsite of the main campus, maintaining patient privacy and things like that are very, very important to us to be able to do that. So when COVID hit and everything shut down, we kind of lost that ability to do that. And currently, we are actually doing COVID testing, drive-through testing at the wellness clinic. So we don't have any employees coming in there. So I was very excited to learn that the saliva kit would be available. That will give us the opportunity to either have it shipped directly to the employee's house, or we can, if for some reason they just don't want it shipped to their house or anything like that, we can provide an avenue for them to pick the kit up without them actually having to come into the clinic and do that. So we have several mechanisms that we can do. We still want to maintain their privacy. And we can also have a meeting with them and help them walk through the process of actually completing the swab and how to do it, because it may be confusing for a lot of people. And we want to make sure that it's done correctly. So those are some options that we have. And then, of course, being able to discuss results through Zoom or Teams or anything like that, to have that face-to-face with them. So we're hoping to initiate that and be able to have those types of interactions with the employees to be able to continue this program down the road that we want it to continue down.
Right, I know you mentioned that you plan to utilize a lot more telemedicine, and that's kind of where you had shifted gears to do this. So implementing those saliva kits, the telemedicine visits, is a way to continue and start this back up even in times of COVID. And I know some of the secondary findings that you found with some of the employees that participated, where you were originally looking at statins, but then found other benefits with other drug classes, is an area where I believe that you all are still looking to expand maybe around November. Is that correct?
We are. The FDA actually came out in February and indicated several medications that the Alliance actually had profile on as confirmed from a genetic perspective to be able to utilize changes in making prescribing patterns, that sort of thing. So one of the drug classes is the antidepressants. And there's a couple of reasons we want to look at this. One is, especially with COVID, it's been very stressful for frontline workers, for everyone. And we want to make sure that if we are having employees that are having to take any type of anti-anxiety or antidepressive or any of those type medications, that they're on the right one, and that it's working appropriately for them. And so we are looking at that population of drugs. We also look at their whole medication profile. We definitely made some discoveries that we weren't planning on. An employee we found out couldn't process Plavix, which was totally unexpected for us. But it can have a key indicator for that patient's overall well-being in the future. So we were able to identify that. The patient is aware, her physician is aware, and now we were able to add that to her electronic health record profile to indicate, hey, she cannot metabolize this drug. Please look at another avenue for her. So we've kind of opened that broad look with the statins, but we're really looking to expand that into those other realms, especially looking at those FDA indicated drugs.
Wonderful. And you just touched on something that's very important. The employee that you identified that could not process Plavix, clopidogrel, that is extremely common. And being able to input that into the electronic health record is very, very important. But that's an area where a lot of genetic testing results, there isn't really a place in a lot of EHRs for that information to go, unless it's a scanned PDF, which then slows physicians down. So Devin and his team at the Hudson Alpha Health Alliance have been working to build a portal. We call it Genome Gateway, but it's a genomic health exchange. And that's one of the key factors. So can you speak a little bit to the challenges, genetic testing, electronic health records, and how we're working to improve that?
Yeah, so as you can imagine, genetic data and genetic test results are different fundamentally from all other lab test results. Once you've had a genetic test of some genes or some genetic variants, you in theory should carry that information with you throughout the rest of your healthcare life, right? That all of your physicians downstream should be able to access that information because you're stuck with those genes. So, and many of the medications we've been talking about in a pharmacogenetic test, a lot of people who might get this test may not be on those medications today, but they may need to be on those classes of drugs 5 years, 10 years, 20 years down the road. So fundamentally, we need the infrastructure in place to enable patients to both keep track of any genetic test results that they have, help deliver that result to all their physicians as they move throughout their life. And there needs to be a trusted resource for that. Most electronic health record systems are not built to store the complex and in many cases large-scale genetic data that is generated on a patient. So at Hudson Alpha, we're really thinking about how to solve those problems, right? How to make genetic data more accessible to patients and their physicians, to make the education around it more accessible to both those parties, and to integrate it more into the existing health record systems so that the clinicians can act on it today and then they can act in the future if necessary. So Genome Gateway is on the simplest level, yes, you could call it a patient portal. It's a HIPAA compliant patient portal, which enables the return of genetic test results back to patients. But it's a lot more than that. It also is a portal and a resource for the clinicians who order the tests. It facilitates the test ordering, the return of results, the communication between the ordering physician and the specialist that they might want to consult with, whether it's a genetic counselor, medical geneticist, or pharmacist, PharmD, with the background in genetics. That sort of communication channel is facilitated through this portal. It's also an educational portal. So all of the content that we've been generating to make employees or patients comfortable with genetic test information, both before the test and after the test, can be delivered through this system. And then ultimately, we need to make that process fully integrated with healthcare systems, EHR. So it's built from the ground up to be an HL7 FHIR compatible system so that structured data can be delivered back to any healthcare systems EHR that supports that mode. And so we foresee a future in which all of this is done electronically, and we can finally be rid of fax machines and PDF, 30-page PDF reports, and build systems that make this data more accessible, understandable, and yet coupled with all the necessary clinical decision support that the clinicians need.
Wonderful. So thank you all for joining us. Nancy, thank you. We've really enjoyed the collaboration between Hudson Alpha Health Alliance and East Alabama Medical Center, and have loved weathering this ride with you through these crazy times. Look forward to getting started again as we move forward and expand that collaboration. And thank you, Devin, for your time today and everything that you've done.